I'm going to jump right into calling our first group of researchers together. So panel A is the First Nation-led presentations, and our first presenters are the Liard First Nation project. The project is called Assessing the Impact of the Pandemic on Mental Health for Liard First Nation Youth. And it's a partnership project. It's led by Liard First Nation and their Health and Social Services Department. The report is also on the back table on the left if you want to pick up a copy. So the presenters are Tara House, Research Lead, CEO of House Business Solutions, and Brenda Gonzalez, Research Assistant Manager at Strategic Initiatives at Kermode Consulting. Yep, come on. And I think you guys get to take a seat over here. Yeah, okay, that's okay. Just because our time, we've got a bit of a time crunch, what we're going to do is have all of the panel A groups come up. So our next group that I'm going to introduce is THG. It's the Enhancing Access for Rural Yukon First Nation Citizens to Culturally Appropriate Mental Health Supports During COVID Recovery. It's a Yukon First Nation-led project with Trondakwachen and the Firelight Group. The panelists are Rachel Olson, President and Director of the Firelight Group, and Ali Tichenko, the researcher for the Firelight Group. And our third group is my favorite, sorry. I don't play favorites. Interjurisdictional dynamics amongst Yukon First Nation and non-Indigenous governance during the COVID-19 pandemic. That is a Yukon First Nation-led project with Council of Yukon First Nations and the research team. So that is Alison Perrin, Yukon University, and Carrie Johnston, One Yukon. Okay. And we've got Rachel and Ali that are online, and you guys are at the top of the screen, so if you want to give a wave, thank you. So I'm going to let the first group, the Tara and Brenda, go first. Use those mics. Yeah, or yeah, it's probably best. Do you need to come over here? Okay.
We'll stand over the podium. Then we can see.
Then you can see it. Yeah, perfect.
I don't need the stool though, that's for
No,
sure.
you don't.
We're good. This is gonna be, I think you're good too.
That could be
Excellent. Yes.
It just goes inside there.
All right. Thank you, everyone. Just waiting for the slide to get queued up there. Here we go. Perfect. Thank you so much. Hi, everyone. I'm so glad you could be here this morning. My name is Tara House. I am a settler colonizer. I'm presently settled in the southern interior of British Columbia on Sinixt land, but also the overlapping territories of the Secwepemc, Syilx, and Ktunaxa nations. Elders Anne and Ruth, there you are. One of you's here. Thank you so much for your lovely opening prayer this morning. I really appreciate it. And especially Ruth, you talked about dissemination and sharing of information, which is wonderful. It's something that really doesn't happen a lot when we end up doing projects and research. To Chief Smith and Chief Lease, thank you so much for not only welcoming us here, but allowing us to be here to gather and learn from each other. Yukon Government Center of Science, what a wonderful project. You mentioned the lack of research, which is definitely something that we've come across for the Yukon in general, but rural research as well. And specifically, Monique and Sabrina, I've worked with a number of governments in the past, and you were a dream to work with, and I really appreciate your efforts putting this forward. Catherine Durocher, just over here to our right, is the Director for Health and Social. She'll be actually joining me for the panel. Thank you so much for entrusting Brenda and I with coming to the nation, speaking with youth on this very sensitive topic. So just a quick overview, we're going to be doing a little purpose and overview of the project in general, kind of going into our research methods, talking about some of the gaps that we found, and then leading into some solutions and opportunities for action. So with that, I'll pass it over to Brenda to kick off the background.
Hi, everyone. My name is Brenda. I was the research assistant for this project. And just echoing what Tara said, just thank you, everyone, for being here and for welcoming us today. Next slide, please. Awesome. So yeah, the Air First Nations Health and Social Department decided to conduct this research just keeping in mind the impacts of the pandemic on the youth, specifically due to school closures, cancellations of recreation activities, and just the limited access to technology and services. So kind of that situation combined with existing barriers to health, such as the location of the community, systemic inequalities, and lack of data, really amplified the need for this research. Next slide, please. So keeping that in mind, we focused our research on being able to provide policy advice, input for strategies, improve policies and process, and identify gaps and opportunities that are all Indigenous-led and co-developed through different organizations. Next slide, please.
Thank you. You look so comfortable up at the panel there. Oh my goodness. We're trying. We know we got to play by ear. Do you need to move? I'm so happy to are you okay there? You can see the words across your face. Anyways, this is what happens. We're trying out new things. So it looked really awkward. So just kind of like a little bit about the research, we really started diving in with a literature review, looking at various health equity studies, really focusing in on creating an Indigenous-led and participatory action research project to ensure that First Nations health is embedded and concepts are right embedded into our report. For some context for those who aren't aware of where Watson Lake is, it is about a 5-hour drive from Whitehorse. And while there are a number of programs and services that are available, run by incredible staff, there's a lot of things that are generally considered fairly basic for access, things like dentistry or physiotherapy that are not available in the Watson Lake area. So when we talk about mental health, we have to look at that holistic idea, again, embedding a First Nations view, not siloing things out. We could have very easily said, what does access to physiotherapy have to do for a youth at Liard First Nation? The reality is that traveling that far is a huge disruption in people's lives, not just for the individual traveling, but also for the entire family. So how does that affect things, having to go that very large distances for some of these generally very basic things? Some existing studies that we did find that actually did incorporate the Yukon, there were not a lot. There was a number of national mental health strategies that just ignored Yukon and the Northwest Territories altogether. As a rural researcher, I'm not overly surprised, but just again, that gap in data is such a huge thing. We know that students in rural communities generally have poorer health overall. There's a massive gender context there as well, where girls in rural girls are really, really reporting poor relationships and overall poor mental health. There's this perception of perceived quality of mental health access and care, which drops significantly once you get out of the Whitehorse region. Just the last thing, one thing we really noticed in both our literature review and our environmental scan of accessible documents from the Yukon government and Liard First Nation is an overall lack of gender analysis and a lack of Two-Spirit LGBTQI plus considerations. So these are just a couple of the highlights that we have found. We can go into the next slide there, talking about some of our participatory action projects.
Yeah, so throughout the project, we got an opportunity to engage with many community members many times. We did it through a diverse methods such as like focus groups, drop-in sessions, surveys, et cetera. Some of the main outcomes that we saw from the engagements was just a very strong desire to collaborate and to improve culturally appropriate services from both the Lear First Nation and from the Yukon government services. We also were able to create a definition of good mental health and culturally appropriate services through the engagements. More on that later. And one of the most important ones is we created a peer-to-peer support program directly with the youth in the high school that would provide education and teachings on how the youth can support each other to improve their mental health and their community in general. Next slide, please. Yeah, and then as we had those outcomes, we also identified some barriers. So telecommunications accessibility, we found that in the Lear First Nation communities, a lot of people do not have reliable access to internet. They use their phone data, which not only hinders their opportunity to access online services, but also it hinders their connection with their friends and their peers to ask for help or get that support. There was a lack of opportunities to be involved in the community. And this wasn't, it wasn't only a lack of opportunities. There were opportunities, but there was a bit of a communication gap between the youth were not aware of the opportunities that were available to them. And kind of having that involvement is a strong driver for good mental health. External relationships between Lear First Nation and other organizations. During the pandemic, we saw a really, really high levels of collaboration, and both service providers were very happy with how they supported each other, but as the pandemic passes through, those services have gone back to independent ways. So returning to that collaboration and thinking about how it can be better is also a big focus of this. LFN's relationship with the youth, there was a bit of a gap in how Lear First Nation could engage with the youth, so we also identified that as an important thing to work with. And there was a very strong desire from all staff from Lear First Nation, Yukon government, and other organizations to increase their training opportunities. Next slide, please. Yeah, so back to the definitions. As we said, we were able to create these definitions through the engagements with service providers and with the youth as well. And they our main goal with these definitions is that they can serve as guiding statements for both Lear First Nation, for other services, and for the Yukon government to improve or to guide their services around them. So the first one is about good mental health. Good mental health is a balance of the spirit, body, and mind that allows a person to learn coping skills to live a fulfilling life and ride the positive and negative stressors in life. Mental health looks different for everyone, and access to individualized resources is important. The other two definitions were around culturally appropriate services. So there is one that is for LFN services, and then there's another one for non-LFN services, which...
May as well read them.
Yeah, so for LFN services, culturally appropriate care means incorporating learnings, traditions, teachings, and values to provide guided care that ties in the stories and histories of land and place. And I can't really read the other one.
Sorry, we weren't planning on reading the full definitions out there. No. Can you read them all? There it is.
Thank you. Oh, thank you. For non-LFN service providers, culturally appropriate care means undertaking training and improving listening to allow for a collaborative approach amongst LFN members and their service providers. Next slide.
Thank you. Okay. Thanks for that quick thinking there. All right, so moving into opportunities for action. So we kind of broke out opportunities for action as opportunities for LFN and also opportunities for Yukon government. Certain things are within each other's spheres of power and jurisdiction, recognizing that LFN can't take on everything. So what are those kind of local things? And so for LFN, we identified kind of relationships and communication as well as training opportunities. 4 key relationships existed, specifically, once again, for youth mental health. There was a need to improve relationships with youth in the community, a need to focus on intergenerational. We heard this really loud from both youth and elders, that they really wanted that intergenerational connection, particularly within the high school. Improving relationships and communication within LFN itself, just ensuring that there's solid communications, sharing of calendars, to not be conflicting with other events that may be occurring, and as well with outside other agencies. As Brenda mentioned, there was this huge, amazing collaboration that occurred during the height of the pandemic, and as that pandemic has evolved, it's kind of broken back down into traditional kind of siloed government services delivery. The beautiful thing about the relationships for rural communities is there's such a strong social capital that exists. There's those really strong interpersonal relationships, and you really can draw on those to improve those relationships. The flip side being that burnout can be really high because one person is generally relied upon to push these programs forward. So really relying on your networks and creating can be a really huge strength-based opportunity as we move forward. And for training, it's pretty basic. I think many people in the healthcare understand some of the barriers related to training in rural communities. There's just not those job skills training opportunities that can often exist that you might get in urban settings, including the cost of bringing, say, somebody in to do training. And this training includes for youth, for improving education and career opportunities later in life. And then for both LFN staff and external trainers, improving job skills, upgrading, and that type of thing. And then there was also the other really strong theme we heard that was really wonderful was from the external service providers, so those that are not working with LFN, they were saying we want cultural awareness and safety training. So there's a really neat opportunity there to develop local training and help newcomers to the community to understand various histories and place. Next slide, please. Yukon government, I know we're getting a little bit short on time here. Yukon government responsibility is really about addressing those systemic inequities that exist. We broke things out into sort of existing legislation and frameworks, things like UNDRIP, something that the Yukon government could definitely be adopting. I do want to recognize that the MMIWG action plan just came out. Wonderful. There's a lot of information in there about rural services, rural health, and youth. Auditor General of Canada did a wonderful report and audit on the mental health services in rural Yukon, 4 great recommendations, and then addressing things like structural inequities, and this is racism in the healthcare system or access to telecommunications. All right. And then just heading into that next slide, we want to talk a little bit about some of the opportunities for action. In general, 3 main things perhaps to keep in mind as a takeaway is that local collaboration can improve the service delivery and really has been done and can be done again. Improved communications to engage and support youth and what they actually want and need would also assist in developing surveys and services and programs. And an increased need for additional funding from senior orders of government to address the various inequities that do exist. Next slide, just to wrap up here. I really just want to highlight that there was some incredibly highly motivated and passionate staff that exists with LFN and Watson Lake. There's a strong desire from external agencies to ensure that culturally appropriate care is actually being delivered. The fact that colonial governments failed First Nations youth and First Nations in general is not exactly a new finding. We've known this for a long time. But what we saw was when agencies partnered and collaborated during COVID, there was an incredible opportunity. People receive the form of health that they need, and that is definitely something that can continue on. However, without some money from senior orders of government to address things like housing, health, our Indigenous youth will continue to struggle in achieving their optimal wellness. So once again, Soga Sinla, we appreciate everyone being here. The report is on the back table. It looks like this, and Catherine will be joining me for the panel. Thank you.
Time. Yay.